This is Dr. Brian Harasha, and I help people who are suffering from dementia and Alzheimer's get their mind and life back. And in this video, I just wanted to share with you what I've noticed are some common progressions in memory loss as people go through this. The first signs of early dementia are really quite common. People often are forgetting where they left their keys, or there's a word that they're trying to think of and they can't think of it, or just misplacing other items. And this is actually pretty normal. A lot of us have this, but for some people, this is actually a problem and a sign of early dementia. And this is where we get ourselves into trouble because dementia and Alzheimer's do not hurt. Most of the time, pain is the main motivator for people to take action. And instead of taking action, people usually make simple excuses like, oh, I was just having a senior moment, or that word was just at the tip of my tongue. The problem is, for people on their way to Alzheimer's, things usually start to get worse. Another common thing I've heard people say is they'll be reading and they'll forget what they just read and they'll have to reread it over and over again. They're starting to make more and more lists to try to remember things. And even in this stage, it's fairly easy to compensate for these problems. You might even give yourself a label called subjective cognitive impairment, SCI for short. And this stage for people that are going to progress to Alzheimer's usually lasts about 8 to 10 years. So it's pretty long where you can have these forgetful moments and compensate for them and not worry about it too much. However, at some point, things tend to get worse. And you'll notice that your lists aren't working quite as well as they used to. You're starting to worry about driving, scared that you might get lost or lose your way. You notice you start feeling a little more fuzzy throughout the day. If you're working, meetings that are in the afternoon are harder to follow. Coffee that used to help you get you through your day is no longer working. Conversations at the end of the day, you might even start feeling like you have to rehearse your responses. So as these symptoms get a little worse, you might actually end up going to get some testing done, and you might get diagnosed with something called mild cognitive impairment, MCI for short. And MCI lasts about 2 or 3 years. During MCI, driving gets even more difficult. You're probably starting to limit where you go. Your notes aren't working as well. You're starting to have sleeping difficulties. You might notice your vocabulary is starting to suffer, and if you knew a foreign language, it's harder to remember it. And I think this stage is actually the most scary because you still have your cognitive facilities, and you'll think about maybe a family member who's had dementia or Alzheimer's, and you wonder if you're going to be next. You wonder what it'll be like for your family to watch you slowly lose your memory. You might even be concerned that your long care health insurance might not cover things once you're diagnosed with a memory disorder. And unfortunately, things really go down from here. You start to lose the ability to remember or even comprehend the things that bring joy to your life. You might lose the ability to observe and understand the people in your life, which is really painful for you and your family members. You lose the ability to perceive the events going on around you and have a sense of place in the world. And ultimately, you lose the ability to perform basic functions of daily living like cooking and eating and dressing and bathing. You've literally lost your humanity, and your ability to identify as someone who has had a meaningful life is gone. After all the work you've put into your life, all the time that you've spent, all the experiences you've gone through, they can all be gone just like that, as if they've never happened. And when it comes to standard medical care, as we stated, they don't have anything to prevent the progression of the disease. They have some drugs that might make the symptoms a little more tolerable and give you a little more time. But I've noticed several caretakers refuse to take these drugs because at this stage, they don't feel like it's really worth having more time. They actually want to get it over with quicker. I'd have to say Alzheimer's is arguably the worst disease in our modern day to have to go through for both the sufferer and for the caregivers. It's the most expensive disease. And I want you to know that it's not hopeless. With the right guidance and tools, people are able to prevent it, to stop it, and even reverse it. So I'd like to invite you to use the links at the bottom of this video to send me an email with some questions, or just follow me on social media. I'll have information about this topic ongoing. And better yet, if you would book a 15-minute free consultation to talk with me to see if you're a good fit for the program I have to offer. Thank you, and be well.